Welcome to PhysioExam Mastery, where we break down complex physiotherapy concepts into bite-sized learning chunks to help you master them in no time. Today, we're covering 20 advanced MSK physiotherapy MCQs to strengthen your concepts and boost your exam performance. Let's begin. Question 1. The Nair impingement test primarily compresses which structure? A. Subacromial bursa. B. Subscapularis tendon. C. Long head of biceps tendon. D. Tears. Major tendon. Think about your answer. Correct answer is a subacromial bursa. The Nair test elevates the arm, narrowing the subacromial space and compressing the bursa. Question 2. The valgus stress test at 30 knee flexion assesses the integrity of AACLB, LCMCLD, pli-R. Answer. The answer is CMCL. This position isolates the medial collateral ligament for stability testing. Question 3. In Maitland mobilization, grade 4 techniques are used for A. Pain relief. B. Joint nutrition. C. Increasing in range motion. D. Proprioceptive activation. Think carefully. The answer is C. Increasing in range motion. Grade 4 involves small amplitude oscillations at the limit of range to restore mobility. Question 4. The prone instability test helps diagnose a spondylolisthesis, B. Facet, joint instability, C. Lumbar hypermobility, D. Disc prolapse. Your guess. The answer is C. Lumbar hypermobility. Pain reduces when the lumbar spine is stabilized, indicating instability. Question 5. Which muscle is a primary dynamic stabilizer of the shoulder joint? A. Deltoid. B. Biceps brachii. C. Rotator cuff muscles latissimus dorsi. The answer is C. Rotator cuff muscles. They compress the humeral head into the glenoid, providing stability. Question 6. A positive Trendelenburg sign indicates weakness of A. Gluteus medius. B. Gluteus maximus. C. Piriformis. D. Tensor fascia lata. The answer is a gluteus medius. Weakness causes pelvic drop on the opposite side during single leg stance. Question 7. The Y-balance test is primarily used to assess A. Core strength. B. Dynamic balance and stability. C. Hamstring flexibility. D. Joint laxity. The answer is B. Dynamic balance and stability. It is a reliable functional test for athletes and rehab patients. Question 8. Isokinetic dynamometry is most accurate for measuring A. Muscular endurance. B. Muscular power. C. Muscular strength. D. Muscular flexibility. The answer is C. Muscular strength. It measures torque output at controlled angular velocities. Question 9. The slump test is used to evaluate A. Hamstring tightness. B. Sciatic nerve mobility. C. Hip joint pathology. D. Pelvic instability. The answer is B. Sciatic nerve mobility. It sensitizes neural tissue tension through combined spinal flexion and leg extension. Question 10. In early postoperative ACL rehab, the preferred exercise is A. Open chain, knee extension. B. Closed chain. Mini squats. C. High impact plyometrics. D. Deep lunges. The answer is B. Closed chain mini squats. They activate quadriceps while minimizing anterior tibial shear. Question 11. The Hawkins-Kennedy test is primarily used to diagnose A. Biceps tendinopathy. B. Shoulder impingement. C. Labral tear. D. Glenohumeral instability. The answer is B. Shoulder impingement. It provokes pain by compressing soft tissues under the acromion. Question 12. The FAIR test assesses which muscle for tightness or irritation? A. Gluteus maximus. B. Piriformis. C. Iliopsoas. D. Hamstring. The answer is B. Piriformis. FAIR stands for flexion, abduction, and internal rotation, stressing the piriformis. Question 13. The reverse Lachman test primarily tests the posterior cruciate ligament. B. Medial collateral ligament. C. Lateral collateral ligament. D. Anterior cruciate ligament. The answer is a posterior cruciate ligament. It assesses posterior translation of the tibia relative to the femur. Question 14. Dynamic valgus collapse during a single leg squat suggests weakness of A. Hip extensors. B. Hip abductors and external rotators. C. Ankle inverters. D. Core stabilizers. The answer is B. Hip abductors and external rotators. Weakness allows excessive femoral adduction and internal rotation. Question 15. The Apley-S compression test is typically used to assess A. ACL stability. B. Meniscal injury. C. Patella tracking. D. Hamstring tightness. The answer is B. Meniscal injury. Compression with rotation reproduces pain in damaged meniscal tissue. Question 16. The hook test is a special test for which tendon rupture? A. Biceps brachii, distal tendon. B. Triceps tendon. C. Patella tendon. D. Quadriceps tendon. The answer is a biceps brachii distal tendon. Inability to hook the tendon indicates rupture. Question 17. ULTT1. Upper limb tension test 1 primarily tests which nerve? A. Ulnar nerve. B. Radial nerve. C. Median nerve. D. Axillary nerve. The answer is C. Median nerve. ULTT1 biases tension along the median nerve pathway. Question 18. The Baton score is used to assess a. Joint hypermobility. B. Muscle tightness. C. Balance and proprioception. D. Functional strength. The answer is a. Joint hypermobility. It uses a 9-point system to identify generalized laxity. Question 19. Scapular winging most commonly indicates weakness of A. Rhomboids. B. Serratus anterior. C. Latissimus dorsi. D. Pectoralis minor. The answer is B. Serratus anterior. Weakness fails to anchor the scapula against the thoracic wall. Question 20. The Cyriax concept is primarily used to A. Plan surgical interventions. B. Differentiate contractile versus inert structures. C. Evaluate cardiovascular fitness. D. Measure muscle strength. Answer B. Differentiate contractile versus inert structures through selective tissue tension testing. The answer is B. Differentiate contractile versus inert structures through selective tissue tension testing. You found this set challenging but helpful. Don't forget to like and share this video with your fellow physiotherapy students and friends. We'd love to have you back for more. But if you want to go further, why not check out our other videos on advanced musculoskeletal physiotherapy or try Last 20 Part 1. Thanks for watching. Till next time, keep those brain cells firing and the good habits rolling. See you soon.